It's a Northwest Lifestyle Weekend on Como News. Now back to IRG's Health Talk.
Welcome back. Dr. Daniel Riegel is our next guest. He is a primary care doc from Mill Creek Family Practice. There's a magazine named Men's Health, and that's what we're talking about with this segment.
Men's health, and men ignore their health. And it's important to kind of follow those steps and that advice and go see your doctor. And Dr. Riegel's going to talk about men's health and some certain stages and things that we should be watching out for.
We don't ask for directions and we don't go to the doctor. Let's find out right now why we should with Shannon O'Kelly and Dr. Riegel.
Dr. Riegel, welcome to Health Talk. Tell our listeners about your practice, your area of interest.
Okay. Well, I'm a family physician. I work at Mill Creek Family Practice, and my area of interest is anything medical from newborn babies up to our dying days. I try to evaluate and treat every condition that we can come across.
How long have you been practicing?
Just about 30 years now.
About 30 years. Okay, so
Yes.
You and I have been doing this a little while together. I'm a physical therapist, been practicing for about 32 years. We've seen a lot of changes in medicine, right?
Absolutely.
Good changes, a lot of good changes in cancer treatment and everything that goes on with technology. But the reality is, it still is the old adage, what is it? An ounce of prevention is worth a pound of cure. And that's what we're going to talk about, is prevention.
Perfect. That's one of the crucial things we overlook.
And I think as a family physician, that's really what your focus is when you're educating and teaching is your patients, whether they're young, middle-aged, or old, really about prevention awareness and trying to get to the root of the problem early if you can.
That's the most efficient way to take on medical issues, is to get in front of them before they get in front of you.
Yeah, we're at the middle of December and just kind of wrapped up the month of November, and I'm going to go back to November because it's a cool month for us guys. It's Men's Health Awareness Month. No Shave November sometimes. People get involved in that. But let's talk about kind of things that men should do, and probably they don't, because men tend to not follow up on medical advice, but they should do it. Let's talk about men's health awareness and prevention. Let's just go through that. Kind of maybe we can do it chronologically. At this age, you start to look at this age, you look at that from a family physician standpoint. That work for you?
That's perfect. Absolutely. I guess the key for men's health prevention is to come in and see your doctor. It is so easy not to see the doctor, to say, I'm doing fine, everything's good, I don't need to see the doctor. But a lot of things happen that are not easily detectable or identifiable. A lot of the main thing about health screening is to identify health risks that might pose a problem in the near future or might be present right now but just not visible. We don't know we have the problem. High blood pressure, for instance, very deadly condition that people usually don't know they have unless they come in and get their blood pressure checked. So that's the key for health screening protocol.
Just out of curiosity, is there they talk about your annual checkup, your annual physical. I mean, are you recommending that even men at 18, 20 or something like that are doing, do you have a recommendation? Is it annual for you, or if you're young, 25, every other year? I don't know if there's any kind of gauge you use.
Right. It's very variable. I have some patients who want to come in every year, no matter what, because they're very health conscious, and I have other people that just don't want to come in at all. For young, healthy people without a lot of risk factors, I recommend coming in at least 18 and get a general screening and try to identify concerns. If we have significant concerns, we might recommend they come in annually or every 2 years or so. If we find somebody that is in extremely good health, a healthy lifestyle, no real risk factors, it might be every 2, 3, or even 4 years to come in.
I think one of the neat qualities and kind of rewards of being a family physician is knowing your patient from the time maybe they're 18 or whatever and follow them through their adult life and making these recommendations and seeing them grow, in ways that you can help them with prevention and education.
That is so true. I can't overemphasize the importance of continuity in healthcare. I have patients who come in to see me who just don't feel right, and it's kind of hard to get to the root of what they're referring to. Now, if I know them well or have seen them for the past 20 or 30 years, I have a pretty good context from which to evaluate them, and we can narrow it down very quickly and efficiently. If they're brand new patients, I have to start from scratch, get their health history, their family history, their other risk factors, and try to develop the context. So continuity in medical care is one of the most important keys to efficient and successful health care.
Dr. Daniel Riegel and Shannon O'Kelly continue their conversation right after this time out on Como.
It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
All right, we're going to continue talking about men's health with Dr. Daniel Riegel, a primary care doctor from Mill Creek Family Practice, with Shannon O'Kelly.
Dr. Riegel, again, thank you for joining us on Health Talk. Thank you for spending time and talking to us about men's health and the importance of building a relationship with a family physician. We're going to play a little game here. I'm going to give you some tests or some diseases, and you tell me when and how they should be monitored. Okay, let's start out with what every man should be aware of is our prostate and prostate cancer. So tell us about PSAs, tell us about the exam, tell us about what you look for.
That is a really hot topic right now because the verdict isn't clear about when to do routine screening. We do diagnostic prostate checks on men with symptoms of some kind, urinary symptoms, blood with urine, things like that. But the screening test is for asymptomatic men who don't have any symptoms. We generally will broach the subject with a man once he turns 50 and talk to him about urinary conditions, risks for prostate cancer. The risks are sometimes a family history of prostate cancer and a first-degree relative. African-American heritage puts you at a little higher risk. For those, we even start at 45 years of age. Even so, we don't necessarily recommend screening. We do have the digital rectal exam to feel the prostate and see if it feels nodular or cancerous in any way. Then we also have the PSA blood test. That's for prostate-specific antigen. And that is something that generally will catch prostate inflammation just by the level going up above normal ranges. Now, it's not specific. It can be a cancer that causes PSA elevation. It can be an infection. It can be non-infectious inflammation. So the PSA test can tip us off to the possibility of prostate cancer, as can a digital rectal exam, but it doesn't mean that's what's going on. The studies seem to indicate that for every life we save from prostate cancer by doing routine prostate screening in asymptomatic men, we have to screen probably 450 men or so. Of those 450 men, many of them are going to have issues. They're going to have complications. They're going to have false positives that lead to more extensive procedures that are just not pleasant to go through. The other issue is prostate cancer is often a very, very slow-growing cancer that often is not fatal. And if we find a cancer, how aggressive do we get in treating it?
I've heard this before, right?
Absolutely. So do we do a radical prostatectomy, chemotherapy, radiation therapy for what might be a relatively benign cancer? I don't know.
All good questions. All good. I mean, the important thing is, I think you would agree that, at least get in when you're 50, start seeing your doctor on a regular basis if you haven't already, and at least be screened.
Absolutely. Or talk about the pros and cons of screening.
Right. As we're kind of wrapping up time here, I'd like to have you back in the future to kind of continue this conversation about men's health and prevention, but we are running out of time. But real quick, tell me about colonoscopy, because it's another hot topic.
Colonoscopies are really critical, and I could go on for hours about that, but I won't. Routine screening for people at the age of 50 and above, and at the age of 40 and above if there are risk factors such as family history, other issues, ulcerative colitis, etc. Good
stuff, Dr. Riegel. Thank you for your time, and we'll have you back to continue our conversation on prevention and men's health.
Well, thanks for having me.
Talking about men's health, and that could be a wide topic of conversation, Shannon, but the bottom line is, again, as we mentioned at the beginning of this little segment, we need to keep track of that stuff and not like, I'll be okay, and then something gets out of hand.
Pretty typical scenario, Tom, is, patients come in and you say, how long have you had this? And, a long time. How come you didn't have it looked at? I just thought it was going to go away. Well, those kind of things, sometimes you just have to have them looked at. It's a peace of mind, and it's better care.
For sure. We'll be back with our final segment coming up after this time out on Como.